I understand you have about 2 decades of clinical data that you're using at NYU Langone. How do you couple that with today's AI capabilities to produce a bespoke approach to healthcare?
Thank you so much for having me, and thank you for that question, because that really is the journey we've been on now for 2 decades. How do we curate and govern the most important resource we have next to our clinicians and our patients? That is the data that combines the two. And we both we have the largest large language model based in healthcare data in the world, second to the Emirates. We have the fastest, highest performing computer cluster dedicated to health sciences. You bring those two together, and you can train these models that we build, that we acquire, that we co-develop on our patients' data. It's not some large aggregated field, but rather it's 20 years of 10, 15 million notes written on our patients.
Amazing.
So our models take care of our patients and are trained on our data.
When we talk about data and AI, there's a lot of safety concerns. I assume so. That's even more so when we're talking about personal data as in healthcare. How are you ensuring that you're using AI to promote safety and efficiency and quality in healthcare?
Of paramount importance. The thing I'm comforted in is knowing that we've been committed to the safety of this data for 20, 30 years. So it's not new for us to handle exquisitely sensitive information. That said, we're also, since we're building our own models on our platforms and that we control, it allows us greater redundancies. And also, when it comes to the end of the day, we're a healthcare shop. Our mission is to provide the highest quality care and the safest care for all that entrust us. And to do that, we spend a lot of time considering that exact issue. And it's not about startups, it's not about creating new companies. So we can committed to those mission. It's much more straightforward.
Another area of concern when we talk about AI is equity and representation, right? And I assume that's particularly important to find effective cures and medicines in healthcare. You have a very diverse patient population at NYU Langone. How are you making sure that all of them are represented in the data sets that you're using?
Yeah. So 7 hospitals in our health system. NYU Langone has 320 ambulatory locations. And what our patient population looks like in parts of Brooklyn versus the Hamptons versus Florida or Manhattan are very different at those particular locations. So whenever we deploy a model that we've developed or built with others, we run it in the background and we look at its performance. And there are examples of, we have one model, the risk of resuscitation. How likely will a patient become sick? Performed differently in the Brooklyn hospital versus Manhattan. So we knew that and we watched it beforehand for several months and tuned to reflect different patient populations. And it turned out it wasn't actually the patient populations, but it was practice differences. The doctors were practicing differently and we could feed that back to them.